Mr. President.
The senator from Rhode Island and the Providence Plantations.
Thank you very much, Mr. President. I would ask that you dispense with the calling of the quorum.
Without objection.
And as a proud resident of Rhode Island and the Providence Plantations, I thank you for your recognition. Mr. President, I want to join my colleagues in expressing strong opposition to the Republican efforts to repeal the Affordable Care Act, and to ask my Republican colleagues to abandon these efforts. They're crafted behind closed doors. They embrace a huge tax cut for the wealthy at the expense of the most vulnerable amongst us. Indeed, I implore Republicans and implore them to work with Democrats on a bipartisan basis and in good faith to make improvements to our health care system. And we can make these improvements. And I hope we can. Just a couple of weeks ago, the nonpartisan Congressional Budget Office told us that 23 million Americans would lose health insurance under Trump care. And let me say that again, 23 million Americans would lose health insurance under the Republican bill. That's more people than live in Alaska, Delaware, Hawaii, Idaho, Kansas, Maine, Montana, New Hampshire, New Mexico, Nebraska, North Dakota, South Dakota, Vermont, West Virginia, Wyoming, the District of Columbia, and my home state of Rhode Island and Providence Plantations combined. A huge portion of Americans. And that's a shocking number. What's worse is that my colleagues on the other side of the aisle plan to dismantle our health care system, 1/6 of the country's economy, without so much as a hearing to get input on the bill. Their bill is being written in secret, and from what we can glean in the process the Republicans are employing, we likely won't even see a text in the near future, although I'm encouraged that there's some discussion releasing the text tomorrow. But regardless of whether it's released tomorrow, there's been no deliberate consideration in a hearing. There's been no thoughtful interaction between Republicans and Democrats. In sharp contrast, and I was a member of the Help Committee while we drafted the Affordable Care Act, the Senate spent 25 consecutive days in session on consideration of the Affordable Care Act, the second longest consecutive session in the history of the Senate. The Senate Health, Labor, Education, Labor, and Pensions Committee, which I served on at the time, held more than 47 bipartisan hearings, roundtables, and walkthroughs on health reform. In fact, the Help Committee considered over 300 amendments over the course of a month-long markup, one of the longest in the history of the Congress. Over half of the accepted amendments were from Republicans. This bipartisan input, along with testimony and consultation from healthcare organizations representing hospitals, doctors, nurses, and patients, among others, over the course of a year led to a better, more informed bill. We have a lengthy legislative process for a reason, yet the Republican leadership, up until this moment at least, continues to write their bill in secret as they look for ways to convince their caucus to support a bill that nearly every major health care organization opposes, to say nothing of the 23 million Americans across all of our states who would lose their health care coverage, and millions more who would see increased costs because of Trump care. And I'd like to remind everyone that these are real people who will be hurt if we go forward as my Republican colleagues intend to. These 23 million people are all of our constituents, our family members, our friends and neighbors. In fact, since the beginning of this year, I have heard from thousands of my constituents from all walks of life through phone calls, letters, emails, appearances at town hall events, even those I see out and about shopping around the state or on the airplane down to Washington back to Rhode Island. And they've all indicated how they've benefited from ACA and about how Trump care could be a devastating impact on their families. For example, David from Providence, Rhode Island, wrote to me to tell me how his life has been affected by the Affordable Care Act. He said, "I don't usually write senators. Actually, I've never written a senator. I have great concerns about my health care. I have a pre-existing condition, 2 heart attacks and open heart surgery, triple bypass. I had medical issues and needed to leave my position at a full-time job 3 years ago to get well. During that leave, the company went Chapter 11. I lost my health care and had no income. I was able to acquire medical insurance through the Affordable Care Act. I started my own design business as a sole proprietor and worked a second job to make ends meet. My health care was subsidized for 2 years. I am now successful in my design business and will be paying back the subsidy for this year and no longer need the subsidy going forward. I am able to purchase affordable health care through the Health Connection in Rhode Island. Affordable health care and the subsidy were there when I needed it. This allowed me to stop my business and become a successful business/sole proprietor in Rhode Island. It is critical for my continued success to have access to affordable health care and not be judged by pre-existing conditions. As David describes, the Affordable Care Act gave individuals and families control over their health care for the first time. He was able to get the care he needed, regardless of pre-existing conditions, and able to start a new business. This is something I've heard a number of times from my constituents. I've also heard from Andrew and his wife in Little Compton, Rhode Island, who decided to strike out on their own and open a dairy farm after the Affordable Care Act was implemented. Andrew said, "We took this plunge and started a business knowing that the stability of health care was there. We have a 4-year-old daughter, and if it goes away, we are not sure what we will do." Time and again, I hear from Rhode Islanders who are now free to take risks and start new businesses and other creative pursuits, knowing that they will be able to access affordable health care. And I ask my Republican colleagues, do you want to go back to the days when people are locked into their jobs for health insurance? Their only reason they're there is for health insurance. Their creativity, their ability to innovate, to invigorate our economy is stifled literally because they need the health care insurance. You want to discourage your constituents from starting these businesses. Well, under Trump care, people like David with pre-existing conditions would not have the option. And Andrew and his wife may not have been willing to take on the risk of leaving jobs with health insurance to start a new business. However, as we speak, my Republican colleagues are meeting in secret, planning to take away these opportunities. I encourage my Republican colleagues to meet with the constituents, to hear their stories about the ACA. They're not unique to Rhode Island. And it's not enough to just ban insurance companies from denying coverage for people with pre-existing conditions. The ACA eliminated annual and lifetime limits. In fact, yesterday I bumped into two families, one of them, a adorable little girl who had a tracheotomy and who was being pushed around. She was about 2 or 3 years old, and met some other children, another young boy named Tim with a tracheotomy. And today I found out that their problem is lifetime limits. These are very young children, 2 years, 3 years old. Most insurance policies, except for the ACA, would have a lifetime limit. You might be able to buy it, but before these youngsters are 10, 12, or 13 years old, they don't have health care insurance for the rest of their life. So it's not just the pre-existing conditions. The ACA eliminated annual and lifetime limits. And when you saw those darling children yesterday, you just knew that that has to be the law. Otherwise, it's just a matter of time. They're, maybe 5 years, maybe 6 years, but the kind of conditions they had, at some point they'll hit that limit, and at some point the insurance company says, no thanks. We made those changes in ACA. They're going to be disposed of in the proposals that I've seen. The ACA requires coverage of basic health care services like maternity care. That's not guaranteed. Before the ACA, insurance companies would cut off coverage just when it was needed most and priced people with health conditions out of the market. And these are not abstract concepts. I hear from constituents each and every day about the importance of the critical consumer protections under the ACA. And Trump care would undermine all of these. Susan from Warwick wrote me to say, Obamacare saved my life. Please keep fighting to make it affordable health care available to all Americans. I was diagnosed with acute myeloid leukemia in 2012. I have my own business and pay for my own health insurance. We purchased what we thought was adequate, but I reached the limit on my policy within just a few weeks of cancer treatment. That left me with huge bills. a need for more expensive coverage in order to obtain life-saving treatment, and technically with a pre-existing condition, cancer. Susan knows that insurance doesn't mean much if you're sick and have limits on your care. She goes on to say, I'm horrified by the Republican plan to replace Obamacare. Health care is not a luxury. It should be available to all. I never want anyone else to experience the fear I did when my insurance ran out and I realized the care that could save my life might not be available to me. Before we found additional insurance and jumped through hoops to get it, we looked at selling the house, emptying our IRAs and our savings account to pay for my care. It would not have been enough. Cynthia from Woonsocket, Rhode Island, wrote to me to tell me about how Trump care would undermine care for people like herself with Parkinson's disease. Specifically, Cynthia wrote about how patients with Parkinson's rely on the essential health care benefits required under the Affordable Care Act, including rehabilitative services, mental health care, and access to prescription drugs. Trump care would do away with these benefits. Cynthia also points out that the average age of diagnosis of Parkinson's is around 60 years old. However, Trump care creates an age tax, leading to skyrocketing costs for this very population. Cynthia also said in her letter that 1/3 of patients with Parkinson's access care through Medicaid. She says that Trump care puts all of those patients at risk of losing care. As a patient, she knows better than most that without these existing protections, health insurance won't actually cover the care that's needed. To add more detail on how critical Medicaid can be, especially to seniors, a constituent living in a nursing home in Pascoag wrote to me to say, I am 101 years old and enjoy every day to the best of my ability. I am petrified that many of the programs that I rely on for my health and well-being, indeed my life, will be reduced or even eliminated. Please protect my access to Medicaid. Do not make Medicaid a block grant to the states. My daughter is helping me to send this communication to you. Please do not forsake me. So I asked my colleagues, how do you intend to protect her access to nursing home care while cutting Medicaid by over $800 billion? Block granting Medicaid, as Republicans have proposed to do, will reduce Medicaid funding by at least 25% over the next decade and leaves states unable to maintain current Medicaid programs, leaving behind our most vulnerable. And indeed, most significant cost for Medicaid in my state and every other state is nursing home care. It's exactly those men and women, like my constituent from Pascoag, a vigorous 101, who will be forced to pay more, who will be forced because of cutbacks in service at the facility, not to have 2 or 3 people on duty, but just one. All of that we can foresee. And we only can prevent if we reject this attempt to replace, to repeal, to undercut affordable care. Now, this Medicaid crisis is serious, and it's not just going to affect the healthcare sector, because we know that the pressures on the states to make up some of this lost funding will not just be by transferring funds within healthcare efforts. They'll have to go everywhere through their budgets. That's K through 12 education. That's infrastructure. That's law enforcement. That's all the things that states and localities do, but particularly states. And they will try to plug the gap because they will have people like I've described who have written me coming and not just demanding, but obviously in need of health care. And they will try to respond. But the response will affect our competitiveness, our education systems, our productivity when you can't fix infrastructure, and it will be a profound impact. In fact, a significant number of jobs in my state and a significant number of jobs projected for the future are in the healthcare industry. When this significant reduction of resources to the healthcare sector comes about, the jobs will go too. Because without the resources, you won't employ the people. You can't employ the people. Now, let me share one letter from my constituents because it succinctly describes what Trump care will really mean for this country. Glenn and Paula from Wakefield, Rhode Island, shared a letter from their daughter, Gianna, who has type 1 diabetes, saying, "Let me offer you a translation of what your votes mean. I will die younger and sicker, probably much sicker. My kids will have a mother for less of their lives. Your votes are what will cause this, because no matter how conscientiously I care for myself, no matter how responsible I am, it won't matter if my insurance refuses to cover me. And it won't matter for you either. If you are one of the vast majority of Americans who will end up with a pre-existing condition over the course of your life, if you can simply pay the cost yourself, you are in for a rude awakening." These are only a few examples of the letters, calls, and emails I received from constituents. The response in opposition to Trump care has been overwhelming by the very people who will impact the most. And I hope that my colleagues will listen to these concerns, not just the Rhode Island stories I'm sharing today, but also from their own constituents. People's lives are at stake. I urge my colleagues on the other side of the aisle to abandon this effort to pass Trump care and start working with us on bipartisan solutions to improve our health care system. And with that, Mr. President, I would yield the floor.